Okay. So we're going to say a few words about extrinsic eye muscles. Then we're going to chat a little bit about the external eye structures. And then we're going to move on to the eye and we're going to even talk about some physiology stuff. Okay. So extrinsic eye muscles. The term extrinsic refers to the muscles that are located outside of the eye. Those extrinsic eye muscles, and you have eye models on the tables. At least I see one. Dylan, Catherine, Katie, you have one on the other side, a tiny little eye. I don't know, Nicole, do you have one? Yeah, good. So you have kind of, cut muscles here, you see. I'm going to represent, basically give you a schematics and how to kind of memorize. There are 6 extrinsic eye muscles. So an eye, an eye, an eye, okay? So this is going to be lateral view, that's going to be front. This is going to be superior view, and this is going to be front, and this is going to be inferior. Well, and it's going to be front. So this is, we're looking from the side. Now, when we look from the side, here's what we see. We see one muscle here, like really see. One muscle here, one muscle here, okay? So this is superior rectus. This is lateral rectus. This is inferior rectus. Okay. I'll explain the terms in a second. We'll look from the top. Look. We see 1, we see 2, we see 3, and we see something like this, 4. So if this is front, and this is a right eye, so nose is here, okay? That's going to be the lateral rectus. This muscle here is going to be medial rectus. This is going to be superior rectus. And this is going to be superior oblique. Now finally, we'll look from the bottom, okay? Front, so let's see, nose here. Okay, so this is what we see. So we see medial rectus, lateral rectus, inferior rectus, and inferior oblique. Let me walk you through this horrible schematic. You have 4 muscles. Look at my hands. These 2, superior and inferior rectus. When they pull, they move the eye into the corresponding direction. Rectus means straight. Superior pulls the eye top, okay? Inferior pulls it down. Lateral and medial. Lateral pulls it outwards, medial pulls it inwards. Does that make sense? Obliques, what you have to remember, oblique means diagonal, okay? They are weird. So superior oblique pulls it out and down, despite the fact that it's superior. And inferior oblique pulls it out and up. Are we clear? So for instance, when I do this, looking up, that's kind of, superior rectus. It's easier with one eye, okay? Up, superior rectus, down, inferior rectus, outside, strictly outside, lateral rectus, strictly inside, medial. When I look at my shoulder, superior oblique. When I look there, inferior. Does that make sense? Good? Okay. External eye structures that are worth mentioning. Okay, some of them I'll just mention because they're kind of obvious. So, eyelids, well, palpebrae, superior inferior eyelid, later palpebrae elevates the eyelid. Eyelashes, sensory function, prevent when something touches eyelashes, you're going to blink. Eyebrows prevent sweat from getting into your eye, so on and so forth. Okay. Now I want to specifically focus on the glands. Okay. You have lacrimal glands which produce tears. That's watery secretion. Okay. You have tarsal glands that produce oily secretion. They are in your eyelids, in your palpebral. Okay. And finally, this is kind of weird. I'm going to put it as a gland, although it's not, well, kind of is, conjunctiva. It's not exactly a gland, so I'm going to put it in the parenthesis as a gland. It produces mucus secretion. Now let me explain, let me demonstrate for you why, it's kind of a gland, but not a gland at the same time. So imagine that you are looking at the very front of your eye, right? So this here is your cornea. Okay. This is an eyelid, and this is an eyelid. Does that make sense? I'm not drawing any eyelashes there. So far, are you following? So conjunctiva will cover the inside of the eyelid and part of your cornea. You see this opening here? So there's basically like a hole. So conjunctiva does not cover the entire cornea. It leaves a little bit of an opening. It's got a hole in the center, basically over your iris. Now, that's conjunctiva. Conjunctiva, there's palpebral conjunctiva and bulbar conjunctiva. Now look, when I pull my lower eyelid, you see the pink layer? That pink is palpebral conjunctiva that covers the eyelid from the inside. A bulbar conjunctiva covers your eyeball. Now, do you see this space between palpebral and bulbar conjunctiva? This is called conjunctival sac. When you put your contacts, they basically go into conjunctival sac. Makes sense? Inflammation of conjunctiva is conjunctival. Spleen bites, conjunctival. Okay, so now we've kind of done with external or accessory eye structures, and we're going to try to make a big ass disproportionate picture of an eye. Okay, and I ahead of time apologize for probably a terrible image that I'm going to generate here. Okay, not the greatest artist. I'll try my best. So it's going to be grossly disproportionate. It's not bad. I did worse. Okay. Now, one plot, please. No, it's third. Okay, so we're going to draw different layers of an eye. And we are starting with an outermost layer, which is fibrous layer. Okay. Fibrous layer consists of cornea and sclera. So this is sclera, and this is cornea. Sclera is a white one eye, and you see why that's sclera. Okay. It's really tough connective tissue where your extrinsic eye muscles are attached to. It's basically an extension of dura mater of the brain, extension of the meninges. Cornea is a most powerful refractory structure in your eye. It refracts light. Does that make sense? Now, on the outside, cornea is covered stratified squamous epithelium. And inside, simple squamous. So when you're rubbing your eyes, you're really just slowing off the layers of the cells on the outermost cornea. Okay, now, cornea does not contain any blood vessels or nerves. Why? Well, okay, hold on. There are some nerve endings, but no blood vessels whatsoever. Why there are no blood vessels on the cornea? Why there are no blood vessels in your cornea? In that structure in front of your eye that refracts light. What would happen if you would have blood vessels running through your cornea? You would what? You would see them. You would have like a network of blood vessels overlaying the actual picture. Does that make sense? So there is no blood vessels in the cornea. Next layer. Let's try to do this. This and well, let's say not the greatest image, not at all, you know, pretty terrible. Okay. So what we see here, we see vascular, which consists of choroid. Okay, so this brown layer is choroid. It supplies oxygen and nutrients. Basically, it's a blood supply to the retina, ciliary body, and iris. Okay. So ciliary body has two functions. There is a ciliary muscle in there, that provides a suspension to lens. Can you see lens here? Lens. And iris, you see that hole? That's a pupil. So iris regulates amount of amount of light that gets in the eye by contracting and dilating the part. Good. So 3 parts to the vascular layer. Very dark choroid, ciliary body. We can talk more about it, and iris. Okay. Now, iris color depends on the amount of melanin that you produce. Okay, so it's just amount, it's not some particular color. Clear? Now, the innermost layer is retinal layer. And so it actually consists of 2 sublayers. Okay. So you have blue represents retina, and purple represents pigmented layer. And together, they are called neural layer. Okay? So if you look at this, fibrous layer, the outermost layer. Sclera and cornea. Sclera is structural support. Cornea is refractory structure. In vascular layer, choroid supplies blood. Ciliary body, among other things, regulates the shape of the lens, allowing you to focus. And iris controls the amount of light that gets in the eye by constricting and dilating. Okay? And finally, neural layer that consists of retina and pigmented. Retina contains photoreceptor cells that allow you to convert light, the image, light that comes in the eye, into nerve impulses, and that's how we see. Anatomically, that story so far, does it make sense? We good so far? Few more kind of random scattered terms. So first of all, these are called suspensory ligaments or ciliary zonules. Okay, they suspend lens. And now, please bear with me. I wasn't the person who decided to create this a bit confusive terminology. So one thing is partitioning of an eye. So the part between the lens and the posterior pole, this part, is called posterior segment. Okay? Does that make sense? Posterior segment. Now, the part between the lens and the cornea is, as you can guess, anterior segment. Okay? Now, that's where confusion begins. The part of the anterior segment, we're going to call it A, okay, between the cornea and the iris is called anterior chamber. And the part B, between the iris and the lens, is posterior chamber. Are you with me so far? Now, we're going to go. So there's a okay, so aqueous humor. You see aqueous humor? Aqueous humor fills the entire anterior segment. It is produced by the ciliary body. It's produced here and here, okay? And it flows, and it flows, and then it drains here at the scleral venous sinuses. Does that make sense? Now, just as any other fluid that is produced and then drains, imagine that the drainage is not good. Are you following me? And drainage is not good, that then aqueous humor accumulates in the anterior segment. It increases the pressure inside of your eye. It starts to push on the posterior segment. We'll get there in a second, okay? Starts to push on the posterior segment. Your intraocular pressure increases, and you develop a condition known as glaucoma. It is usually treated either by surgery, or there are drugs that dilate scleral venous sinuses and improve drainage. Does that make sense so far? Okay, awesome. Now, what is in the posterior segment? Posterior segment is sometimes called vitreous chamber because it is filled with vitreous humor. Now, you may it may seem kind of odd, the word humor. Humor means fluid in Greek, okay? Now, vitreous humor is not produced, it is not drained, it's there for your lifetime. Okay, we're good so far? Make sense? Okay. Any questions here? Yeah. No, we good? All right. Let me get rid of some of that stuff. We will discuss how lens work. Okay, because this part, it's not confusing. Okay. So, what you see on this gorgeous image is sagittal section of a knife. Does that make sense? It is done like this. What I'm going to do now, I'm going to do a frontal coronal projection. So projection like this of one particular part of an eye. It's going to be ciliary body. Okay, good. So check it out. Inside of the ciliary body, you're going to find a circular ciliary muscle. Can you see that circle? Good. So it's like this. Okay. In the center, there's lens. Okay. And lens are attached by the suspensory ligaments. Okay, good. So what happens when you look at something far? So I'm going to put distant vision. Okay. Distant vision. Before we move on, I want to ask you one basic question. When muscle contracts, what happens to its length? Does it become, when it contracts, does it become shorter or longer? Anyway, it's a 50-50 question. Huh? Short, yes. So remember, contraction means shorter muscle, relaxation means longer muscle. Okay? So when you look at something distant, your ciliary muscle is relaxed, which makes it longer. Does that make sense? Good? In terms of, if that's the circle, and we say that circle is longer, what happens to the diameter of the circle? It increases. Good? Makes sense? So as the ciliary muscle relaxes, the diameter of the circular muscle increases, and those ciliary ligaments, okay, it's a suspensory ligament, start to pull on the lens in the center. And as they pull on the lens in the center, lens flatten. Okay? So what we can say is that ciliary muscle relaxes, lens flatten. That makes sense. That's how you look at something distant. Okay? This is under sympathetic control. Because when you are in a condition of stress, fight or flight, you really need to look at something that is distant, dangerous. Now, when you are relaxing on the couch, reading a book, so you are under parasympathetic control. That's the case of the closed vision. Under parasympathetic control, your ciliary muscle contracts, making the diameter of that circle smaller. Okay, which leads to relaxation of suspensory ligaments. You see they're relaxed now, and bulging of the lens. So ciliary muscles contract, lens bulges. Okay, and that is under parasympathetic. The confusing part here is that students often think, oh, if ciliary muscle contracts, then those ligaments should be tight. Quite opposite. When it contracts, ligaments actually become more loose. So far, you following me, right? Good, good, fantastic, good. So that brings us to the concept of myopia and hyperbole. Okay. So during normal vision, if this is your eye, okay, and I'm not going to draw the entire eye, I'm just going to draw the back of it. So that's the eye, that's lens. Lens focus the light on the retina. Okay, so that's normal vision. Now, when we get older, for instance, many of us develop what is known as farsightedness. or myopia. Okay? In this case, your image is focused behind the retina. Okay? Some people have it genetically. We often say that the eyeball in this case is too short. Okay? And you can correct farsightedness by the concave lenses. No, that's not concave, that's convex. Pardon. Convex lenses. Many of us wear glasses or contacts because they are actually short-sighted. Sorry, you didn't catch my mistake. Farsightedness is hyperbole. Short-sightedness is myopia. Okay. In this case, the eyeball is too long, so the lens focuses the light in front of the retina, and that can be corrected by the concave. Does that make sense? Good. So, what is astigmatism? Astigmatism is uneven shape, usually uneven shape of the cornea, which leads to focusing some parts of an image in front of the retina, some parts of an image behind the retina. So in the end, it's like all blurry and stuff. Now, you can do special glasses, but you also can do surgery. So LASIK, you've heard about this, I suppose, the laser surgery for now. It actually targets cornea, not the lens. So in LASIK surgery, the surgeon will kind of reshape the cornea to properly focus the light on the retina. Does that make sense so far? Good, any questions? Got it? Okay. Few words about iris. Dilation is under sympathetic control, and the muscle is dilator pupilla. Those are smooth muscles, so they are under involuntary control. Contraction is under parasympathetic control, and it's under the sphincter. Okay. I'm just trying to think. Okay. Let's talk about gretna. So, can you get rid of this? Everybody put up? We're going to add some more structure, one more structure on this image. But right now, let's focus on neural layer. Okay? So this is how it looks. First of all, you've got pigmented cells, a layer of pigmented cells. Okay? Now I'm going to draw kind of a primitive photoreceptor cells. And finally, okay, so what are those cells? These two are cones. The red ones are rods, and these are photoreceptor cells. This is the pigmented one. The cells in the middle are bipolar cells, and cells on the left are ganglion cells. So now look how light goes. So light, pay attention, the light goes in this direction. Okay. First of all, isn't it odd that light goes this way? What do you think? Like, genuinely, what do you think? For me, it's always kind of, kind of a stupid organization, because light has to go through all those cellular layers to get to photoreceptor cells, the cells that actually convert light into nerve impulses. Make sense? You understand what my confusion is? And it's a great example of nature being suboptimal. Like in the ideal world, you would say, what if we would be able to kind of flip all those layers, okay? Put photoreceptor cells immediately to the light, and then collect all that information, and bipolar and ganglion would be behind. Does that make sense? Are there animals with such organization of an eye? The answer is yes. Giant squids. They live in a very dark environment, deep in the ocean. They need precise vision because of the prey that they hunt. So they have to have it. We find. You see what I'm saying? It doesn't have to be the best. It has to be good enough. And this is good enough for us humans to survive. You see what I'm saying? Not a great, but it's okay. Are we clear? Now, basic idea of light perception, very basic. Light is perceived, absorbed by photoreceptor cells. Photoreceptor cells generate signal. I deliberately say just generate signal. The signal goes through the bipolar cells to ganglion cells. And ganglion cells, they form optic nerve. And this optic nerve, so basically your retina is an extension of the brain. This optic nerve, those fibers go all the way to the thalamus, and then to the synapse in the thalamus with the second order neurons and visual cortex, blah, blah, blah. Okay, but it goes straight in the brain. That makes sense. So anatomically, your eyes, especially retina, retina of your eye is an extension of the brain, and sclera is an extension of the dura. You good so far? Now, if you would look at the picture here, you would notice that there is no retina. There are no photoreceptors here where optic nerve leaves an eye. This place is called optic disc or blind spot. But last time I checked, we don't have a blind spot in our eyes. The reason for it, our brain compensates for what we kind of don't see. Does that make sense? Because we constantly move our eyes back and forth. Good? Now, let's discuss the differences between the rods and cones. So cones, they have very high threshold of activation. What does that mean? they need a lot of light to start producing the signal. So cones are responsible for sharp color vision in the bright light. So right now, you see me, you see the board, you see the class via cones, okay? Each cone has its own individual path to the brain. Now, rods have low threshold of activation. Vision in dim light. No color, okay? No color, and the vision is really fuzzy. Are you following me? Converge on bipolar cells. So what does that mean? If you hear an individual person speaking, you can tell the words apart, if that makes sense. If you listen to a choir singing, often it's really hard to tell the words apart because there's so many people with their own individual, quirks, how they say things and stuff like that. Make sense? So individual plots to the brain make sure that the picture has very high resolution. Are we clear? Convergence of multiple rods on the same bipolar cell gives an advantage of a really of amplifying signal so you can see in the dim light, in the darkness. But since it's like 200 signals going to one bipolar cell, that creates a picture that is kind of very much less in terms of resolution. Am I clear? Resolution size in this case. Also, cones have three colors. Cones can be red, green, and blue. So you can ask, hold on a second, how do I see purple, right? So purple light activates, say, red and blue. Does that make sense? Yellow light will activate red, but to a certain extent. So these slight differences allow us to distinguish the whole spectrum of colors. Now, color, in this case, refers to visual pigment. So visual pigments that allow you to see red, allow you to see green, blue, and then when they spectra overlap, you see different colors. Make sense? Now, color blindness is when you don't have a particular visual pigment. Does that make sense? You may have lower expression of a pigment or its complete absence. Does that make sense? That will determine the level of kind of impairment of colored vision. For instance, a complete impairment is achromatopsia. People do not see colors at all, they just see kind of grayscale images. People, and that is a good example of genetic disorder. So people genetically lack the expression of a particular pigment, okay? Color blindness is overwhelmingly male condition. Okay. Good. Questions? Not so far? All right. So basically, the Holmes roads, just trying to figure out what else we need to mention. Yeah, we're going to talk about some pathologies. Let me just throw a last little bit about cones and rods. So in the back of your arm, if you look like, if you take ophthalmoscope and look in the eye of a person, with the light, in the back of an eye, you can see a loosely defined structure called macula lutea, literally a yellow spot. In the center of that yellow spot is a tiny, tiny, tiny little area called fovea centralis. Okay? So what is unique about fovea centralis? It contains only cones. Are you with me? Only cones, nothing else. So when you are, let me give an example. Look at this model. Like, look at it. The image of this model right now is focused on your fovea centralis. Whatever you're looking at any given moment is being focused on the fovea centralis. Sharp colored vision. Does that make sense? As you move away from fovea centralis, the number of cones getting lower and lower, and number of rods rises. Am I clear? So a good example would be right now, can I see Nicola with my peripheral vision? Yes. Do I see her? Like, is the image sharp? No. Can I tell, for instance, the color of her jacket? With my peripheral vision? Absolutely not. Because rods do not distinguish colors. Does that make sense to you? So peripheral vision is like a vision in a dim light. Okay? No colors, really fuzzy. We're good? So understand what is fovea centralis and why it has the sharpest vision. Question?
No.
Huh?
I was just looking at this.
Actually, kind of more peripheral, and I don't know. It's kind of so here for some reason. Don't remember. I was doing some kind of an eye exam at BMV. I don't remember why, but when I was getting my driver's license first time, it was actually in Nebraska. So I was tested, and they were like doing lights in the periphery. So I had to detect what color is a light on the periphery of that little machine. And turns out my peripheral vision isn't perfect, even for peripheral vision. Does that make sense? So I probably shouldn't say it on the record, but whatever. When I had driver's license in Nebraska, I had a restriction. I cannot drive without a right rear view mirror. You see what I'm saying? Like, some cars have left mirror and the big one in the windshield. I had to have the right one because of my not perfect peripheral vision. And then probably bureaucracy just lost this, and now I don't have this restriction. Anyway, that makes sense? Now, few conditions regarding the eye. We already mentioned glaucoma, right? Increased intraocular pressure. So kind of related to this is papilledema. But in papilledema, basically in glaucoma, pressure comes from here. Does that make sense? In papilledema, pressure comes from the brain through the optic nerve. When people have increased intracranial pressure, it starts pushing cerebrospinal fluid along the optic nerve, basically bulging the optic nerve from the retina. Bulging optic nerve impairs optic nerve function, and it starts to destroy retina itself. Does that make sense? Increased intraocular pressure pushes on the retina, and that's not good. Okay, retinal cells become swollen and engorged, and vision deteriorates. This condition, papilledema, is quite common among the people who experience regular sudden changes or significant changes in the environmental pressure. You may wonder who they are. Pilots, mostly military pilots. In military pilots, it's kind of a professional disease, but even in civilian pilots, it's also known sort of professional risk to develop ability. Does that make sense? Another condition, cataract. Cataract is claudication of the lens. It can be congenital. Some children are born with it. Some genetic stuff. But mostly it's a wear and tear. So my dad, who is 83, he's got his lens replaced, one lens, one of the eyes this year, and he's waiting to get second one. Okay, just because of the age, sunlight exposure. He doesn't smoke, but smoking is a risk factor. Mostly sunlight exposure. So yeah, that's kind of what we all looking forward to. Okay. Retinal detachment, usually result of a blow to the head, like a big ass blow to the head. Common in boxers and people who play American football. Okay. So basically what happens, retina separates from the vascular layer that impairs vascular blood supply to the retina. Retinal cells, essentially neurons. Neurons do not survive without blood, so they start to die. If you reattach the retina quickly, that's okay, that's good. Okay. It'll kind of repair, right? Now, last little bit, really interesting condition. So macular degeneration, when this part of an eye, this part of a retina starts to degenerate, you're basically losing vision. Macular degeneration can be genetic, okay? But for us, I think more sort of epidemiologically significant cause of macular degeneration is diabetes. So what happens, it's a condition that is called diabetic retinopathy. When people are diabetic, and I specifically want to highlight with a poorly controlled sugar, okay? That leads to the inflammation of the blood vessels that supply retina. That inflammation makes those vessels leaky. The plasma and blood cells start to get basically into the retina. That leads to the inflammation of the retina itself. Now, since blood vessels are leaky, blood supply isn't great, so eye tries to compensate by literally growing new vessels. But it's like trying to make a proper water supply to a house by installing more and more leaky pipes. You see what I'm saying? So that aggravates the injury and eventually leads to retinal deterioration and blindness. It's one of the big side effects of poorly controlled diabetes. Now, it is completely preventable condition if the person makes sure that blood glucose levels are properly controlled, there is no vascular inflammation in the eye, and so on and so forth. So basically going to endocrinologist and to optometrist for that. We clear? A little cord that I forgot to mention kind of goes to the light perception. So when the light gets into the eye, remember the sclera is white. If inside of your eye would be white, light would scatter all over the place. Make sense? Pigmented layer here and choroid layer here, they absorb all that light that gets through, preventing the light scattering. Does it make sense to you? By the way, this is why when you look into the pupil is black because all light is absorbed inside of the eye. Any questions? We're going to stop here because we finished on this material with wonderful.